straps contained in the patient care kit. Install the 2 leg boards to the tabletop. Slide them over the foot end of the tabletop edge, placing the tongue of the leg boards inside the iliac sacral mount assembly upright and secure with the locking knob. Now place 2 pillows over the patient's legs and check the patient's knees to be sure there is no interference with any bracket. Apply 2 safety straps around the lateral tabletop and over the pillows on the patient's legs, positioning one strap as close to the pubic sacral mount assembly as possible and the other one over the patient's feet. Verify that all locking knobs are in their locked position. Do not rotate the patient until all locking knobs have been secured. Leg board, 1 locking knob each, left and right. Iliac sacral mount assembly, 3 locking knobs each, left and right. Chest scapula mount assembly, 2 locking knobs each, left and right. Lower arm board, 2 locking knobs. Upper arm, 2 locking knobs. Head support bracket, 2 locking levers. And head support assembly, 4 locking knobs. To ensure that all pads are adjusted to their optimal compression, it is suggested that the tabletop be rotated 25 degrees in each direction and that the pads be adjusted during this step. To accomplish this, release the rotational friction control and the patient transfer safety lock at the foot end of the table. These controls will remain unlocked for the remainder of the procedure. While the tabletop is being held, release the head-end patient transfer safety lock with one hand and slowly release the head-end rotational friction control with the other hand until the top can be rotated. Do not disengage the 25-degree rotational stop. Rotate the patient 25 degrees in the prone direction and lock the head-end rotational friction control. The patient has probably compressed the anterior pads, allowing space between the posterior pads and the patient. Adjust the compression on both the sacral and scapula pads by loosening the lateral lock knob on the mount assemblies. Press the pad against the patient until it is slightly compressed and retighten the lateral locking knob. Then, while an attendant holds the tabletop to prevent its rotation, slowly release the head-end rotational friction control and rotate the patient back past center, then to the 25-degree supine direction, and lock the head-end rotational friction control. The patient has probably compressed the posterior pads, allowing space between the anterior pads and the patient on the mount assemblies. Adjust the compression of the chest and iliac pubic pads by loosening the lateral lock knobs on the mount assemblies and pressing the pads against the patient until the pads are slightly compressed. Then retighten the locking knobs. Then, while an attendant holds the tabletop to prevent rotation, release the rotational friction control and return the table to level. Engage the patient transfer safety lock and the rotational friction control at the head end. An attendant must hold the table whenever the rotational friction control is unlocked to prevent accidental or excessive rotation. Examine the patient's contact to each pad carefully during this adjustment procedure. Look for potential high pressure points or excessive skin folds and adjust as necessary to resolve. Leave the patient transfer safety lock and the rotational friction control at the foot end of the table unlocked so that one person at the head end can control rotation if required during surgery. Recheck the position of the arms, legs, and head with special attention to the face, especially around the eyes. Prep and drape the patient as required. To rotate the patient up to 25 degrees during surgery, hold the tabletop securely and slightly loosen the rotational friction control at the head end of the table. Disengage the patient transfer safety lock, rotating the table if necessary. Loosen the rotational friction control if necessary and rotate the table to the desired position. Apply rotational friction control to the max locked position before removing the supporting hands from the tabletop. Never let go of the tabletop while the rotational friction control is released. Failure to hold the tabletop may result in dropping the patient. To rotate the patient more than 25 degrees during surgery, hold the tabletop securely and slightly loosen the rotational friction control at the head end of the table. Then release the 25-degree rotational stop at the head end and rotate the tabletop to the desired degree of rotation, making sure it does not exceed 90 degrees in either direction. Tighten the rotational stop to the max locked position before removing supporting hands from the tabletop. Keep the head end patient transfer safety lock engaged whenever the tabletop is horizontal. Do not leave the patient in a fully prone or supine position for more than 30 minutes at a time during surgery. Excessive pressure may result. At the conclusion of the case, the components must be removed in a specific order for safe transfer of the patient. Remove the 2 safety straps securing the legs. Remove the gel safety strap at the hips. Remove the 2 leg boards. Reposition the lower arm board away from the tabletop, allowing space for the patient transfer boards to be attached. Install the patient transfer boards anteriorly and posteriorly and lock in place. Remove the upper arm support. Remove the head support assembly. Remove the chest and scapula mount assemblies with the pads attached. And, while holding the patient securely, remove the iliac sacral mount assemblies with the pads attached. Then remove the table clamp from the transfer side of the table. Roll the patient onto the stretcher in a supine position. This concludes the demonstration of the maximum access lateral tabletop setup for simultaneous anterior-posterior spinal procedures. In the following segment, we will demonstrate how to set up the maximum access lateral tabletop for total hip procedures. Attach the lateral tabletop with the wide end directed toward the head end to the removable H-frames at each end by inserting a T-pin through the H-frame in the 6th open hole down from the crossbar and through the round connector of the lateral tabletop and then out the opposite side of the H-frame. Next, remove any clamps or accessories that may be attached to the tabletop, except the patient transfer boards. If the transfer boards are not already in place, insert the transfer boards into the foot end receivers from below and raise them until they are level with the table. With the locking mechanism just lateral to the lateral tabletop, push the patient transfer boards in medially toward the table until they are locked. Check security by pulling laterally on the boards. Then apply patient care kit covers contained in the patient care kit to all pads that will be used. The table is now ready to receive a patient. Transfer the patient to the tabletop in a supine position with the patient's head at the head end of the table. Adjust the patient so that the pubic area will rest approximately in the center of the contoured section of the lateral tabletop. Now attach the IV arm boards under the tabletop pad on both sides of the lateral tabletop. Then apply the disposable pads contained in the patient care kit to the IV arm boards and position one arm in each IV arm board. If the patient has not already been anesthetized, it should be done at this time. Remove the two IV arm boards, then roll the patient into a lateral position to the appropriate side. Attach the short arm board and rest the patient's arm on the arm board. Carefully position the patient's non-operative side hip, greater trochanter, and shoulder humeral head on the downside directly onto the midline of the lateral tabletop. Now place a gentle touch headrest pillow contained in the patient care kit under the patient's head. At this time, an attendant should be assigned to support the patient until the pelvis is secure. Attach one tabletop clamp loosely to each side of the table at the level of the patient's xiphoid process, utilizing the three-spoked handle. Insert the iliac sacral mount assembly with the total hip pubic pad attached into the table clamp on the patient's anterior side. Position the pad against the patient's pubic area and secure the table clamp tightly to the table with the three-spoked handle. Secure the iliac sacral mount assembly vertically with the black plastic locking knob on the table clamp and laterally with the flat aluminum knob located on the mount assembly. Insert the other iliac sacral mount assembly with the sacral pad attached into the table clamp on the posterior side of the patient. Position the pad against the sacrum and secure it in place vertically with the black plastic locking knob on the table clamp. And laterally with the flat aluminum knob on the mount assembly. Adjust the short arm board and secure the patient's arm to the short arm board with the arm board straps contained in the patient care kit. Next, slide the chest scapula mount assembly with the chest pad attached onto the tabletop on the patient's anterior side and secure it with the locking knob. Use caution as it slides into position to ensure that it will not impact the patient's face. Position the chest pad at the midline of the patient's sternum, utilizing the vertical adjustment knob. Slide the clamp along the tabletop edge until the superior edge of the pad is positioned at the patient's suprasternal notch, and lock the mount to the table. Adjust the pad against the patient and secure it with the lateral locking knob. Insert the upper arm support into the chest scapula mount assembly and adjust the upper arm support to hold the patient's upper arm. Rotate the arm to maximize access to the patient's face. Then secure the patient's upper arm to the upper arm support with the two straps contained in the patient care kit. Next, slide the chest scapula mount assembly with the scapula pad attached onto the tabletop on the patient's posterior side and secure it with the lock knob. Adjust the height of the pad with the vertical height adjustment knob so that the pad is between the patient's scapula, and secure it against the patient with the lateral locking knob. Remove the patient transfer boards at the foot end of the table and secure the patient's well leg to the tabletop with the 2 disposable straps contained in the patient care kit. Now apply a safety strap around the patient. Verify that all locking knobs are in their locked position. The patient is now positioned for surgery. At the conclusion of the surgery, remove the safety straps from the well leg, install the patient transfer boards, remove the upper arm support, remove the chest pad with the mount attached, remove the scapula pads with the mount attached, remove the pubic pad with the mount attached, remove the sacral pad with the mount assembly attached, remove the table clamps from the patient transfer side, remove the remaining safety strap, remove the short arm board, and roll the patient onto the stretcher in a supine position. This concludes the in-service section relating to the maximum access lateral tabletop. We hope you have enjoyed this in-service training tape and trust you have found it informative. All of us at OSI look forward to assisting you with your patient positioning needs. We thank you for your support and attention. This video is intended to illustrate the operating mechanics of the OSI modular table system components. A model has been shown solely to help visualize patient placement on the equipment. This video is not intended to fully demonstrate correct patient care techniques for positioning, nor substitute for perioperative patient assessment. The application techniques outlined in this tape are the manufacturer's suggested techniques for proper operation of the equipment. The final disposition of each patient's care as relates to the use of this equipment rests with the attending physician. For information concerning patient care considerations when using OSI equipment, please contact your local sales representative or call 1-800-777-4674 to schedule a session of the AORN Contact Module, enhancing patient outcomes through precise positioning at your facility.